to get to know you a little bit more. So I'd like to start off with some questions. What year student are you? Do I have any first or second year students? Freshmen or sophomores? Juniors or seniors? Perfect. Any postgraduate students, MPH or PhD students? Okay. And what field of study are you guys in?
I know I have a bachelor's of public health.
Okay, public health.
Bachelor's of
Public health. Okay.
Engineering.
Engineering, perfect. And over here?
public health.
Public health.
Public health as well.
All right, perfect. Okay, so in one word or phrase, why did you choose to pursue your career path in public health? We can go around the room again.
Because I wanted to be a doctor, but I didn't have the skills to be a doctor, so I just wanted to be something in the health field. Public health fit perfectly. So.
Perfect.
I just like the aspect of public health. It's much different than regular healthcare.
And you, sir?
Just to serve better to the people.
All right, thank you. And you ladies?
I transitioned from a different background, different experience, and after I served in the Peace Corps as a community health volunteer, I realized that I really wanted to maximize my health knowledge, and public health seemed like the best way to do that. So I pursued my graduate degree.
Awesome. Do you want to share?
Yeah, I liked looking at the bigger picture of things and how it's important to everybody and it impacts everyone, individual and world level. So
Right. Well, thank you all for sharing. Everyone has their own reason of why they want to pursue a field of healthcare. We all have our own story, and so today I'd like to share that story with you. I am originally from Tisnasquas, Arizona, and let's see this quicker. It's not clicking. Let's see. Battery died. Okay.
Is it on, like on the side?
There we go. It was working 30 minutes ago. So like I mentioned, I'm originally from Tisnasquas, Arizona. That's where my family is from. That's located in northeastern part of Arizona. And I was born and raised in New Mexico, born in Gallup at the Gallup Indian Medical Center. I grew up in Farmington and Albuquerque, New Mexico. And I actually went to Eastern New Mexico University to play college softball. And I was driving around yesterday, driving around campus, made sure I knew where this building was for today, but I passed by the softball field and it just brought back a lot of great memories because I actually pitched in a game on the NMSU softball field when I was at Eastern during a tournament. So it just made me feel very grateful for the journey that I have taken and just made me that much more excited to share that journey with you today. And honestly, time goes by so fast. It's already been 15 years since I was in undergrad. So really take it all in and really enjoy the process of learning, enjoy your classmates and your professors and your lecturers, because once you start your career profession, it goes by twice as fast. And you're not really surrounded by that uplifting undergraduate go-getter academia setting. There's different challenges in your career. And so thank you all for joining again. I hope that by the end of this session, you learned something new and that you're able to take some valuable experiences from my journey and hopefully maybe apply it to your journey as well. And so I grew up in Albuquerque and Farmington, but I spent a lot of summers at my family's house in Tisnasquas, Arizona. I spent a lot of summers with my grandmother, and she didn't have running water or electricity, and she only spoke Navajo. And so during the summers, I would haul water for her. I would herd her sheep. I would hang out with my cousins. We would get up early in the morning and cook breakfast. We would tend to the lambs, and we really experienced the rural reservation life. And one of my memories of her, along with all the great memories, was the image of her having to take a big white tablet when she ate dinner. And as a kid, I always wondered, what was that tablet? Why did she have to take that? Why did she have to take it every day at dinner time? And then I also saw her have to put a needle by her stomach at bedtime. And back then as a kid, you wonder, but you don't really ask questions. And so that memory of her and wanting to learn more about that, later along the line, I found out she had type 2 diabetes, but that curiosity of wanting to learn more of why she had to take that white tablet and why she had to take that insulin was kind of the driving force of why I pursued a career in healthcare. And I honestly didn't know as a student that I wanted to be a pharmacist until I shadowed another pharmacist at the Fort Defiance clinic I work at. My first major was mathematics. I wanted to be a math teacher and be a softball coach because that was what I was used to. I loved playing softball. I was an athlete. But it wasn't until I went back to the Fort Defiance Indian Clinic and I shadowed different healthcare providers. I shadowed a doctor, a PA, a nurse, and a pharmacist. And I met an amazing Navajo pharmacist, and she actually is still working at that hospital today. And I got to work with her when I worked in Fort Defiance. But she was just really inspirational. And I love the fact that as a pharmacist, we were able to educate patients. We were the advocates for patients. We could explain the medications to the patients. And we were also part of a multidisciplinary team with the doctor where we gave recommendations to the doctor, check for renal clearance, liver clearance, dose medications, check their creatinine clearance, respond to codes and things like that. So that really excited me, and the variability of being a pharmacist excited me as well. And so I switched my major my sophomore year, and I switched from mathematics to biology. So I majored in biology and minored in chemistry. And so I think that it's good while you're in school, if you're not really quite sure what you want to go into, to shadow someone, to seek mentors and shadow, because that really gives you the opportunity to know on a day-to-day basis what that particular person does in their field. And so going back to the story of my grandmother, I had always wanted to go back and serve my people. I wanted to educate patients just like my grandmother, and I wanted to be of service to those patients in those communities. And so I learned about the public health service, and I'll go ahead and I'll talk about that a little bit later. But being a commission officer in the Corps, you're of service. It's a service job. And so I think my goals and the Commission Corps' mission co-aligned together well, which is why I chose to be a Commission Corps officer. But I wanted to add some stats. The Indian Health Service vacancy rates. So there is a high need for mid-levels and doctors like physicians, PAs, nurse practitioners, and also nursing and dental. The vacancy rate is on average about 18%. So there really is a high need for healthcare professionals to go back and serve in those rural needed areas. And these are stats of an average IHS area. So there's 12 different IHS areas. So this is an aggregate data of those vacancy rates. And in the more rural areas, the vacancy rate is even higher. So I just wanted to give you a glimpse of some of the roles that I did while I was at Fort Defiance. And once you find your niche, say you're going into nursing, in school you'll be able to rotate different specialties. You might be in the ER, you might be in ICU or MSU or outpatient. And in school, you'll kind of gravitate to what you like the most. And so I really enjoyed Fort Defiance because of the variety of clinical opportunities that it offered me. And compared to, from an IHS facility or tribal, compared to a retail pharmacist, the duties are a lot different. IHS and tribal have more clinical duties as a pharmacist versus retail. So just wanted to share some of those examples with you. We have a diabetes clinic, an anticoagulation clinic, asthma, tobacco, and then we also have a pharmacist that works in the primary care clinic and the pediatric department, where we answer drug information questions. We're there for the provider to answer any questions they have. Sometimes we actually go into the patient room and do a medication reconciliation or an insulin administration demonstration. So we're shifting from like working in silos to multidisciplinary teams. And then we also have specialty pharmacists, so pharmacists that manage HIV and hepatitis C medications. I help manage the TB chest clinic medications. And then we also have a pharmacist that monitors those patients that are on dialysis, because they really do have a lot of medications. And we actually travel to the dialysis center. We talk to the nephrologist, we talk to the social worker, the nurse. So we have a panel of providers and have that comprehensive care for meeting our patient outcomes. But with all of these, there's public health integrated in all these specialties. So if you do go into public health and decide to work in rural areas, there definitely is a need for that public health approach. And I have a slide in here where it kind of shows that clinical to community linkage to public health. So I wanted to dive into talking more about the diabetes clinic, because this is one of the clinics where pharmacists were able to really experience the challenges that patients face in rural areas. We had 45 minutes with the patient, and we got to really help them with their diabetes management. And providers, you know, they only have a certain amount of time to be with the patient. Their first new patient eval could be 45 minutes, and then follow-ups are only 20 minutes. And so what if a patient has like 10 comorbidities, diabetes, hypertension, pain, all these things the doctor has to address in 20 minutes. And so to help provide better care, the doctor refers patients out to diabetes clinic or tobacco or dietitians or medication therapy management. So in the diabetes clinic, we were able to assess the patient's blood sugars. We were able to titrate their insulin, their metformin, their oral tablets, and we also were able to really listen to the patient, to listen to the barriers that our patients express to us. A lot of the patients in rural areas, they don't have adequate transportation. They live in rural areas that are about 45 minutes from the clinic, and those are all barriers to optimal patient outcomes. And even some patients, they don't even have electricity. And so what happens when you have to give a patient a medication and it requires extensive refrigeration? What do you do in those cases? Also, elderly patients, there are sometimes concerns where they're living alone and they don't speak English, and concerns of, are they safe at home? Do they know how to take their medications? Are they doubling up on their doses? So in those cases, we would send a referral for a home health visit from the nurse. And so that way the nurse can go to the patient's home and make sure they're okay. So to help overcome some of the barriers of the challenges that I saw, if someone had transportation issues, we would see if the patient qualified for transportation service, or we would also try to sync their appointments on the same day, or maybe extend their appointment. So I would say, okay, you have a provider appointment coming up in 4 weeks. Let's try to schedule your diabetes appointment before or after that appointment, or try to sync it up with another like dietitian or dental appointment. And then also, as a pharmacist in the clinic, we were able to give referrals to the wellness team. And so if a patient was really motivated to exercise or needed to lose weight to control their sugars, we would send a referral to the wellness team. And then if a patient needed mental health consults, we would let the doctor know to send a mental health consult for the patient. And I just wanted to share a quick story with you. So one of my fondest memories of working in the diabetes clinic was a male patient about 55 years old, and he always came into the clinic with a hat on, and his hat, the bill was like down to here. And so I couldn't really see his eyes. And I asked him questions, but he would not give me the information. He would say yes or no, or he would like shrug his shoulders, or he would say like quick phrases. And he just seemed like he was really just struggling that he was diagnosed with diabetes and had an A1C of over 10%. He was just really struggling about the fact that he had type 2 diabetes. And I kept working with him. I kept being positive. I said, okay, let's try this. And I kept providing him resources and being encouraging to him. And so 5 or 6 months later, his lab test came back, and we got his sugars down to less than 7%. So that was amazing. And that was the first time I saw him smile. That whole 6 months, he gave me one big smile. And he took his hat off and he shook my hand. But as he was leaving, he just told me, he said, thank you for not giving up on me. Thank you for encouraging me. And he told me that he's like, yeah, once I left your door, I thought about what you had to say. I thought about the changes that you're recommending to me. I thought about the dietary changes that you wanted me to make. And on my drive home, I live 30 minutes from here. My whole drive home, I thought about what you were telling me. I thought about what would happen if I just let my sugars be like this. And he said, I listened to you. And he said, I know that it seemed like I wasn't listening to you, but I was. And he said, thank you for being my support. And so that's why I put up there in quotes, we are their support system. A lot of these patients, especially in rural areas, they don't have the support system at home. They don't talk to their spouse or family members about their conditions. And a lot of the times we are their support system. That patient, you might be the only encounter for that patient for the next 3 to 4 weeks until their next visit. And so that's one question we ask them when they first get to the clinic is, who are your support system? Who can you talk to about your diabetes? And over 50% of the time they say, I don't have anyone. And then I say, do you have a cousin? Do you have a friend? Do you have someone you can call or a neighbor? And they're like, no. And I said, we'll be your support system. The pharmacists in here, the doctors, if you need someone to talk to, we will be here for you. And then I write down, we have like a paper, and we have our clinic, and we have our telephone number, and we have a list of all the diabetes pharmacists. And so I give them that paper for them during their first visit, and I say, you can call us and let us know if you have questions. Even if you forget your dose, if you don't know how much insulin to take at bedtime, you can always call us. So also cultural humility, that is so important, especially when you're working in cultural communities, because if you don't have cultural humility, I don't think I would have made that type of impact with that patient if I didn't practice cultural humility. If there was no mutual respect for that culture, if there was no trust with that engagement with that patient, I honestly think that I wouldn't have had that outcome. We wouldn't have seen those lab results with that patient. So just to kind of give you some more examples of clinical work. So Fort Defiance and many IHS facilities have an outpatient setting and an inpatient setting. And so as pharmacists at Fort, we also work the clinics, but we took turns with different shifts. And the inpatient shifts, we were in charge for responding to codes. So if we heard a code on the intercom saying pharmacy to ER, we take our medication cart. This orange one right here has a list of all the intubation medications and other code cart medications, syringes, needles, filter needles, IV bags, things like that we would carry. And so usually if the stretcher is available in the ER, I would just put the code cart right there. It's like really quick. It happens so quick. Put the code cart, you get your medications. This right here is my Sanford guide. It's a dosing book, and so I had dosing references, because once you get there, the ER doc shouts out what they want, and then you ask for the weight and you write it down, and then you dose it and you give the nurse the medication and they administer it. So one of great experience, but it's also a high stressful shift as well. But in rural areas, there may not be enough staff to fully staff just inpatient. So a lot of the times those hospitals will have patients rotate, outpatient and then inpatient. So Fort Defiance, along with other IHS facilities, have a lot of different student rotation opportunities. And so I would highly recommend when you're in school to seek out those different types of rotation opportunities as students. So for Defiance, if you're a student, a pharmacy student, the meals are provided for $25 a day. There's housing, really nice housing right next to the hospital. And there's actually a lot of students that rotate at for. We have nursing, pharmacy, medical, and flight medic students, and a lot of various community outreach opportunities that are available too. And so this is the example I was talking about earlier, the community to clinical linkage. As a pharmacist, I think that while I was there, I really gravitated towards the diabetes clinic, and a lot of those patients, they came in with an A1C of 10, 11, 12. And I'm like, why didn't they know? And a lot of them said they didn't even know they had prediabetes. They didn't even know they were at 6%, 7% even. And so I'm like, So I created a healthcare screening team. And so this was a mix of nurses, a provider, a pharmacist. We had pharmacy students. We had people from the wellness department and also public health nursing. And so we teamed up to create a healthcare screening team. And so we implemented a diabetes screening day. And so we had a lot of different health booths set up in the hospital. And then we had patients take a diabetes risk factor. And so if they scored high risk, then we would direct them to another room, and we had an on-site A1C machine where we could test their A1C. And we had a provider there and a nurse there. And so we were able to capture some patients that were diagnosed with pre-DM, and we even caught a couple of people with diabetes too. And so the next year, we created a men's health screening team as well in 2017. So I think that's one of the prime examples of a community to clinical linkage, and a prime example of collaboration and teamwork from the clinical staff and also the public health side. All right, so lessons learned. I did work in Fort for 6 years, gained a lot of valuable experience, and I was an IHS scholarship recipient, payback. I had 3 years of payback, but I stayed for 6 years. And honestly, the main reason I stayed is because of the service. For serving those patients, just like that patient story I talked about, for being there for them, for advocating for them, for educating them, for creating sustainable projects that will better the facility and end result better the community. And also, I became a preceptor too, so I precepted pharmacy students, and I was also able to create those community projects as well. But lessons learned, so just in general, if you do plan to work in a rural area, I would say to really immerse yourself in the community, to be accepting of culture, to be willing to learn different cultures, and to seek opportunities to increase your collaboration in that area. There's a lot of 5Ks, outreach, hiking, a lot of like luncheons and potlucks in the community. So it was in a rural area, but I didn't feel alone. I was surrounded by people that were motivated and had the same goals as me. And also identifying mentors throughout your career. I'm sure you have mentors or people that you hope to be like once you start your profession. I think that's really important while you're in school, but also really important when you start working. I wish that I sought more mentors when I first started working in the pharmacy and in my early career, because I felt like there's a different transition and a different learning curve when you go from academia to professional real life. And that's one thing that I would recommend, is to seek those mentors earlier. I probably would have sought mentors in public health, because that was one of my main interests, probably about a year out when I first started at Fort Defiance. So identifying those public health mentors, identifying people that work in jobs that I could see myself working in later on. Also identifying people that had really great leadership skills. I think that's really key, especially when you're working in teams, when you're trying to get people to be on a team to see your vision. So I think definitely seeking those leadership skills out while you're in school, identifying projects or outreach where you're able to practice those leadership skills. So leadership, you are a leader. Once you're out in your career, you are a leader. You're a leader to your community. You're a leader to future students as well. You're a leader and you represent your community. And then work-life balance, this is definitely a big lesson learned too. I think that sometimes we get so focused on carving our skills and getting those clinical certifications. But I think it's also just as important to take time out for yourself to make sure you're, get those hobbies in. I love to golf. I still love to play softball. I love to go to the gym. I love kickboxing. So that's really important to balance out the stress of your work environment too. So I wanted to put this slide in there because I've definitely felt like Simba at multiple times in my career. I was very anxious, I think, for the first time I staffed by myself as a pharmacist over the weekend. I was like 6 months out into starting my job, and they're like, well, we need someone to staff next weekend, so you're available. And so I was the only pharmacist with 2 technicians. And then also another scary time was when I staffed the inpatient pharmacy by myself. I was the only pharmacist available for codes or intubations, and so I had to rely on my resources. But basically, all in all, we have to start somewhere. You just got to start somewhere. We may not be fully confident, but we are confident. When you graduate from school, when you graduate from nursing school or your particular niche, you have the resources and the education to be effective and to be 100%. But it's just that learning curve and being comfortable in your environment. So does anyone have any questions about Fort Defiance or any of the slides from until now?
Where is Fort Defiance exactly?
So does everyone know where Gallup, New Mexico is? It's about 30 minutes northwest of there. Yeah, and it's actually a tribal facility, so it's called Tehoto Medical Center, but it's in Fort Defiance. And I think they were IHS like 10 or so years ago, but then they transitioned from IHS to tribal. Yeah. All right, so the U.S. Public Health Service. Does anyone know or have heard of the USPHS? Show of hands. Okay, all right, so it's great to hear that a lot of you are interested in public health or are getting their MPH degree, because the Corps does accept those with an MPH. And so our mission is to protect, promote, and advance the health and safety of our nation. As a Corps officer, you're able to work for any of the Department of Health and Human Service agencies. And we also are on call for deploying domestically and also international. And so here's a list of some of the common categories in the PHS. So we do have a lot of nurses, and then a runner-up is pharmacists, and then this category called HSO, which is a combination of different ambulatory care disciplines like physicians, assistants, PAs, optometrists, dental, computer scientists, psychologists, social worker, microbiologists. And then we also have medical doctors, engineers, environmental health officer, EHOs we call them, scientists, dental therapists, dietitians, and veterinarians. So that's the categories that qualify to be a PHS officer.
Shannon, can I ask a question?
Yeah.
What is a health service officer?
So a health service officer, it's like so there's like all these categories right here.
Oh,
So
okay.
it's just like I guess like a general term for all of these professions, like combined.
Would your job title be health service officer?
Yeah, so that would be your professional category, HSO, health service officer. But then you would still be functioning and operating as like a PA or optometrist. Yeah, yeah. Mm-hmm. And so as a Commissioned Corps officer, we're able to work for any of the Department of Health and Human Service agencies, and we do have a high number of officers at the IHS. So there's about 1,700 officers at the IHS. And this is an average of like pharmacists, nurses, HSOs, all the categories that I mentioned in that previous slide. And then surprisingly, FDA is in second. There's 1,200 officers at the FDA. And of course, there's the FDA in Maryland, but there's also FDA field offices throughout the country too, just like there is with CDC. The CDC hub is in Atlanta, but I currently work at the CDC field office in Albuquerque, New Mexico. And there's also CDC field offices just throughout the country. So we also have CMS, the BOP, NIH, the National Institutes of Health. I have a nurse friend that works there. She helps assist with different research projects at NIH. And then let's see, we also have EPA, USDA, and SAMHSA. All right, so if any of those categories fit within your healthcare profession, there is something called the Junior Co-Step. But the only thing is the Co-Step program is only offered for engineers, environmental health, pharmacy, and nurses. But it's basically a program where you can temporarily be an active duty officer when you're in that health professional school. So when I was in pharmacy school, after my first year, I did the Junior Co-Step. And so I did like a 12-week internship at a local IHS called Santo Domingo Health Clinic. And so I had to wear the uniform. I learned more about the Corps. I learned more of what it takes to be an officer. And so that's really when I decided that when I graduated, I wanted to be a Commissioned Corps officer. So if you know of a student that might be interested in the Corps, that's a nurse, an engineer, environmental health, or pharmacy, this is definitely a program that they should consider while they're in that particular discipline. All right, so the last 10 minutes or so, I'll go ahead and talk about the CDC. But first, did anyone have any questions about the Commissioned Corps? I know it's kind of a lot that I said in like 2 or 3 slides. Yeah.
Do you have to be working for one of those federal agencies in order to be a member of the Corps?
Yeah.
It is, so that's why deployments can happen. That's why you can leave. If you're deployed, you can just leave and then come back to your job.
Right, right. And a lot of times that, like what I did in 4, I was a civilian at 4, and then I was working on my paperwork, and then I became active duty and transitioned from a civilian to being an officer at 4. Yeah. But now, for deployment, so we have about 2 months out of the year where we're on call for deployments, and they'll send us emails saying, you know, we're calling for pharmacists to deploy for X reason, we're calling for nurses, we're calling specifically for public health specialists or for engineers. Like they'll have different callings of different categories that they want to deploy. And then deployments are usually between 2 weeks to 30 days or 45 days. Some will require a minimum of 30 days with potentially deploying up to 60 days. And so it's really important too to kind of let your new supervisor, if you're planning on transitioning to a new job too, to let them know, like, I'm a Commissioned Corps officer, like these are the expectations too. But in general, like they're familiar and, you know, it's for the mission too. So they're very accepting of the deployments. Any more questions? All right, so I work as a project officer with the Centers for Chronic Disease Prevention and Health Promotion, which is under the Division of Population Health. And I work with a team of 5 in Albuquerque, New Mexico. There's a field office. So there's 5 people from my team that work with this center with me. And the other part of our team is in Atlanta. So we do a lot of Zoom calls and Zoom meetings over the camera. And then we also have a total of 4 project officers. So basically, as a project officer, I help provide technical assistance to a grant called Tribal Practices for Wellness in Indian Country. And so this is a cooperative agreement where we were able to fund 36 tribal and urban Indian organizations. And you'll see here, the reds are urbans and the blues are tribal. But this is a really unique grant because this grant supports tribal practices, tribal traditions and culture as a protective factor for strengthening resilience and well-being in American Indian communities. And so as a project officer, I help oversee 14 of the 36 recipients. So I provide TA assistance, I ensure they're meeting grant deadlines, I make sure they're on track with their work plan, I overlook their budget. So it's definitely a transition from being a pharmacist, but I feel like the skills that I learned at Fort helped me transition over into the public health job at CDC. So I wanted to talk more about this grant because it's really innovative. Like I mentioned, it supports tribal tradition as a pathway for health and wellness in Native communities. And so basically our 36 recipients can choose any of the 7 strategies here and aim to work towards meeting those strategies in their work plan. And so you'll notice here that all of these strategies have cultural elements. You have intergenerational learning, traditional and contemporary physical activities, traditional foods, family and community engagement, tribal, intertribal collaborations that strengthen well-being. So this is a really unique grant. It's something a little it's different than the usual grants from CDC, but it's basically supporting tribes and tribal ways and saying, we're going to give you money to host a drum workshop. We're going to give you money to host a fish camp, to buy all the fishing supplies, the baits, the hook, all the cooking utensils. Recipients are having sweetgrass harvesting and berry picking. So all different types of traditional activities that are meaningful for that particular community. And so this grant provides the funding for the staff to help implement these activities. And like I mentioned, the supplies for all of these cultural workshops. And it's really neat. In Alaska, they were able to identify a set of elders to help come in and teach their stories and their traditions of what they learned and how to properly catch a fish and prepare it from start to end. And within those teachings, stories are tagged on. And so the grant is able to support practices like this. It's really unique, and I'm interested to see like where the grant's going to take us after this, and just kind of keep a lookout, because if you start to work in tribal communities, and it's good to know what other grants are available within your facility that you're working at, because there's possible cross collaboration with the community side to the clinical side as well.
How long is the grant period?
So it's a 3-year period. Yeah.
When did it start?
It started in 2018, and then each recipient gets up to $150,000 a year. Yeah.
Is it too early in the grant cycle to know how some communities are overcoming historical trauma in terms of wellness, like around behavioral or other issues?
Yeah, I think it's, we know that it's there, and we know that based off the stories that we've heard from our recipients, that the grant does impact and influence mental health behaviors on a positive end. But in terms of evaluation, I feel like we're not really there yet. I think we need more time. But other divisions like the Division of Injury and Prevention, they've been interested in too in this grant. Yeah. And also recipients, they host sweats too for like prayer and mental health. So the grant does support the supplies for sweats, and also I think they have like a sweat coordinator. I can't remember how they called it, but it's great that it supports things like that.
Is there potential for a grant renewal cycle?
Yeah, there's potential. So we're hoping that it's renewed, and hopefully we'll get awarded something that's a longer duration, maybe like 4 to 5 years. So the last thing I wanted to talk about was the PHAP program. I'm just going to go ahead and pass this around just in case, but it's an opportunity postgraduate. If you're interested in gaining hands-on experience in public health, with the CDC. So basically you apply for the PHAP program and they assign you at various government and non-governmental agencies from across the country. And you get real life public health experience for the next 2 years. And then after you graduate, you qualify to apply for a public health job, potentially at the CDC or other public health agencies and organizations. And so I wanted to play a quick video. It's a testimonial from one of the PHAP recipients. Let's see if it's still up. There we go.
I chose PHAP because working for the CDC is a once-in-a-lifetime opportunity that I didn't want to pass up. I am located here in Atlanta, Georgia at Healthy Mothers.
Oh, pause it, sorry guys.
Healthy Babies Coalition of Georgia, where I work with a diverse staff of women who hold me accountable, and I have a high level of responsibility there. What I love most about my experience is that my executive director and my whole site supervisor have acknowledged one of my weaknesses, which is public speaking. And any opportunity that I get, they send me out into the community to speak about our organization. And I really appreciate that because it shows that not only do they want to see me grow professionally, but personally as well. And I appreciate that. And I just have had a once in a lifetime experience.
So that's the PHAP program. So I definitely would encourage you to apply if you're interested in public health and gaining some hands-on experience. There is a site that's available in Albuquerque at the Department of Health, and then also under one of our sister cooperative agreements under the Healthy Tribes program, there's an opportunity available at the Aztec site in Albuquerque. It's like a tribal epicenter. And then also there's a position at the Center for Native American Health in Albuquerque too. So the last slide I wanted to talk about was after I graduated from pharmacy school, I wanted to serve in an underserved area internationally. It's always been a dream of mine and a goal of mine. And so I decided to apply to a medical mission with the International Medical Relief. And so we provided care to rural areas for, went to 8 different locations in Kenya, Africa. And we provided care to almost like over 6,000 patients. I remember one day we set up like at 7 a.m. We ended like 7 p.m., 8 o'clock when the sun was going down. And we saw over 1,000 patients in one day. And we had a team of 30. This is our team. We had 4 doctors, 2 pharmacists. We had, I think, like 4 or 5 nurses. And then we had a dietitian. And then the rest were public health employees and volunteers. But I wanted to show this to you because if you have a dream, you can do it. You can pursue it. And there's a lot of resources out there. There's a lot of organizations out there that really need our help and our knowledge in these types of environments. And so it was definitely tiring, but one of the most rewarding experiences I've ever had. And it just makes me realize we're so blessed to be in a country where we have clean drinking water. We have access to even the restroom, like just to even come back to being able to utilize a clean restroom and to have drinking water, to buy water in a bottle just like this, and to have that, to have those opportunities here in this country. And I was asking pharmacies in Albuquerque if they could donate stuff, so they gave me those prescription bags, which came in handy. And so that says Cipro 500 milligrams, number 6, I think. But anyway, to help categorize our medications, and we have meds here that were everywhere. And then I took a picture of right here because this was the line of people waiting for us when we got there. We had almost hundreds of people waiting in line. And then I included this picture here because I was counseling this patient on antibiotics, and I wanted him to take it with water. And before I can even explain it, he grabbed the water and he like drank it so fast, he spilled all over himself. And so